People from all walks of life face personal issues every day. You don't need to go through it alone. Help is available. For more than 40 years, Zumbro Valley Mental Health Center has been a leading behavioral health provider in the area. Whether you or a loved one needs help with a drug addiction, counseling, or other mental health issue, our team of experts provides the highest quality treatment in a private, peaceful setting. This video highlights our professional, compassionate approach to clients' behavioral health needs and how we can help provide you with responsive and effective care.
Zumbro Valley Mental Health Center was started in 1966. We serve about 5,000 patients a year, and at any given time we see about 1,800 patients that are active with us. Our mission is to help each individual achieve their greatest potential. And we do that through providing a wide array of treatment services. The vast majority of our clients that we see at Zumbro Valley are underserved or uninsured. We have a very close partnership with Olmsted County. We also work with Fillmore County. We work very closely with Mayo as well, and Olmsted Medical Group and other providers in the community. About 2 years ago, we started looking at the idea of adding services to Zumbro Valley. We were really impacted by one study in particular done by the Robert Woods Johnson Foundation. They looked at individuals who had these two serious conditions, mental health and also a comorbid medical condition, and the fact that over their lifespan they lived 25 years less than the normal population. What we concluded was that we need to do something more for the clients that we serve. We also looked at the ACEs study, looking at early childhood trauma and how that impacts adults later in life with serious medical conditions and mental health. We realized we need to do something working with children, men and women. So we put a group of community partners together. We've been working together over the last year or so, trying to figure out what needs to be done, how are we going to do it, how are we going to pay for it, and we've made significant progress. We have a lot of capabilities in dealing with all kinds of problems, whether it be substance abuse or mental health. But the clinician's job or the case manager's job or the psychiatrist's job at Zumbro Valley is to find ways to help that individual become what they want to become.
Zumbro Valley Mental Health Center offers outpatient psychotherapy and psychiatry, case management. We also have parent coaching, a child guidance team where we come together and staff all new cases with a multidisciplinary team. Zumbro Valley Mental Health Center views its role as trying to reach out to each and every person that needs assistance. The underlying theme in all of the programs at Zumbro Valley is teamwork. We have multidisciplinary teams in every facet of care that we provide. We know that for individuals that suffer with chemical dependency, addictions, that a lot of times they also suffer from a mental illness and vice versa. We also have a full-service pharmacy on site. We also have dental care. So we're able to reach out and not only help somebody with their behavioral health needs, but we can also help them start to meet the physical health needs. For me, working at Zumbro Valley Mental Health Center is really about being able to help every person achieve their own personal potential. An adolescent, for example, that has really struggled, and I have parents saying thank you because for the first time I feel comfortable that my son or my daughter is going to be able to go on and they're going to be able to lead a successful life. That's what makes me think, okay, I've helped someone today.
What we're trying to move toward is seeing each client actually as unique from an aspect of the biopsychosocial model, looking at what are the biological factors, what are the psychological factors, and what are the social factors that point toward health. I'd like to see the brain and what's going on in people's bodies as sort of the background against which the mind has to function. It's not enough, again, to just hand someone a pill, all right? They have a life, they have a personality. So we begin to coordinate what we're doing with people. We don't just say, well, you need chemical dependency treatment. Many of these people have a mental illness that's also going on. So we see people as unique, but also coordinate all their care.
We have an opportunity here to provide something that we believe our clients are not getting as they should, that for a variety of reasons they're not accessing primary care services, and that if we could provide that on site and stabilize some of these conditions that are serious, like diabetes and cardiovascular disease, these individuals could not only live longer, but we believe in the short term they could really get better. So we're very excited about this. We know that we're getting closer every day.